Hello, everyone. My name is Xinyu You, and I'm currently a high school student in Western Reserve Academy. So I'm going to talk about the review paper I wrote about investigating the relationship between obesity and cancer. All right, let me share my screen. All right, so table of contents. So over here is the different slides and the topic it will be covered, and all the topic and the information will correspond to sections within the review paper. So current challenges with the obesity crisis. So 1 in 5 children in the US struggle with obesity. By 2020, around 770 million individuals was affected by obesity, with numbers likely reaching 1 billion by 2023. Each year, obesity imposes a financial burden on the society, costing the US healthcare system an estimate of $173 billion. Obesity can lead to all causes of mortality, including type 2 diabetes, high blood pressure, sleep apnea, breathing problems, coronary heart disease, and potential causes of cancer. In fact, obesity consists in about 4 to 8% of cancer patients, including breast, colorectal, esophageal, kidney, gallbladder, uterine, pancreatic, and liver cancer. So here's the methods I used for the review paper. So I used reputable sources such as Google Scholar, NCBI, CDC, WHO, and NIH. The research focused on English papers published within the last 20 years. Keywords such as obesity, cancer, diabetes were centered to the search. Studies were included based on their examination of the link between obesity and cancer epidemiology. Only studies published in peer-reviewed journals or conferences proceedings were considered. So the different types of obesity, there's actually 4 phenotypes of obesity based on the metabolic phenotypes. And on the x-axis on the left chart, you can see that there is a BMI, and on the y-axis has the risk of obesity and diabetes and cardiovascular disease. Interestingly, as we can see, in metabolically unhealthy non-obese, there is a low BMI, but there could be a higher risk of cardiovascular diseases. Whereas for metabolically healthy obese, there is a high BMI, but the patient is healthy. Compared with individuals metabolically unhealthy obese, patients with metabolically healthy obese are characterized by lower liver and visceral fat, but higher subcutaneous leg fat content, greater cardiorespiratory fitness and physical activity, insulin sensitivity, lower levels of inflammatory markers, and normal adipose tissue function. These are the characteristics that allow people to remain having a high BMI, but having a lower chance of obtaining diabetes and cardiovascular diseases. So for the review paper, I mainly analyzed 3 different types of cancer, which are colorectal cancer, breast cancer, and liver cancer. For colorectal cancer, I concluded that obese colorectal survivors have a higher risk of developing second obesity-associated cancer compared to survivors with a normal weight. For breast cancer, the adipose tissue led to a higher estrogen level in female patients, and estrogen fuels the growth of cancer cells by promoting the diversion of breast tissues and raising the likelihood of mutation that led to cancer. In a recent Harvard University study, which indicates that estrogen is a key player in cancer development as it directly influences how cells repair the DNA. For liver cancer, obesity links to a higher risk of non-alcoholic fatty liver disease, abbreviated into NAFLD. Obesity-related NAFLD links to liver inflammation, leading to an increase in the production of different cytokines and adipokines, which have been implicated in hepatocarcinogenesis. So the link between obesity and diabetes and cancer. So hyperglycemia can provide cells with more energy for dividing and affect growth factor secretion. Type 2 diabetes has been linked to an increase in cases of obesity-related cancers, including colorectal, hepatic, pancreatic, breast, and endometrial. Hyperinsulinemia, a characteristic of metabolic diseases like type 2 diabetes, facilitates epithelial tumorigenesis by disrupting cell competition. Although the direct mechanism between insulin resistance and inflammation in the body remains unknown. In individuals with diabetes and insulin resistance, inflammation markers such as tumor necrosis factor alpha, interleukin 6, interleukin 8, and C-reactive protein have been observed to be elevated, indicating the presence of inflammation, which can potentially cause cancer. So obesity and inflammation. How does obesity cause inflammation, and how does inflammation cause cancer? So inflammation is induced by white adipose tissue, and inflammatory cells adapt to the tumor microenvironment, which plays a crucial role in promoting the growth, survival, and motility of cancer cells. When inflammation occurs in the body, reactive oxygen and nitrogen species, abbreviated into RONs, are produced to battle pathogens and to vitalize tissue repair and regeneration. However, these chemicals can also damage DNA, which in turn can promote cancers through the mutations in the DNA sequences. Additionally, RONs can interfere with the DNA repair mechanisms by reducing their efficiency. So cancer metastasis and obesity. So the adjacent adipose tissue creates an optimal microenvironment that fosters tumor growth, progression, and metastasis, where adipose sites secrete adipokines, fatty acid, and other soluble factors that support tumor cells. Proximity to fat tissues, as seen in prostate, pancreatic, breast cancer, and esophageal adenocarcinoma, encourages tumor growth. Fat cells release substances supporting tumor development, and immune cells infiltrate the tumor area. Obese fat tissue closely resembles an environment that facilitates cancer spreading. So on the right, you can see there's a chart of how obesity alters the lung immune landscape to support breast cancer metastasis. So here's a few resolutions that came up during the research. So here's a few general recommendations from WHO. And then in general, promoting healthy behavior with children is really important by teaching children healthy behaviors from the beginning, especially during school. And pregnancy nutrition is also important as it can help infants from obese. And emphasizing both the quantity and quality of food pregnant woman consumes during pregnancy is essential. And conclusion. So obesity is a global epidemic causing diseases and straining the global medical system. Significant correlation exists between obesity and various cancers, including conditions like inflammation, type 2 diabetes, and NAFLD. Despite being preventable, obesity has become a major health concern in recent decades. The healthcare system requires more data to adapt to the challenges of treating and detecting cancer in individuals with obesity. All right, thank you. If you have any questions, my email is this. Feel free to ask me any. And here's image sources. Thank you.